We are continuing to talk about the national unrest and protests. That's why we are bringing on Dr. Payal Kohli. Dr. Payal Kohli, thank you for joining us. Those who have been watching DBL, you know that she's given medical advice about COVID-19 for months. And to new viewers, Dr. Kohli is a Harvard medical graduate and board certified in internal medicine and cardiology, as well as being a prevention expert. And doctor, as we saw last night, the movement in many cities is staying strong, which we love, but we're also getting a lot of viewer questions saying, is there a way that we can protest safely?
There is, Sam. So the way to protest safely is really to understand the risks of what happens when you're at a protest. And there's two main health risks that occur. The first is with respect to the spread or the contraction of COVID-19, because we are in the midst of a pandemic. And the second risk I want to talk about is the tear gas and the risks to your health from that. So let's talk about COVID-19 first. If you think about a protest, it really creates the perfect recipe for COVID-19 to spread. You've got many people, social distancing is difficult, they're from all different parts of the community. The duration of contact is prolonged. You have lots and lots of respiratory droplets because people are shouting and screaming. There's tear gas, so they may be coughing. There's pepper spray, they may be sneezing. And they don't have good hand hygiene because they're touching a lot of surfaces. And in the case of tear gas, they may be touching their face. You can also imagine that contact tracing is very difficult. So to mitigate all of these risks, you really have to understand them and do the opposite. So try to maintain that distance, wear those masks, carry hand sanitizer with you. I would recommend not just a mask, but also eye protection actually at the protest to keep that tear gas out and also to minimize the likelihood of touching your face. And then one thing you can do is actually decrease the duration of contact. So instead of going for an hour once a week, go for 15 minutes 2 or 3 times a week instead, so that that duration is minimized. When it comes to the tear gas tends to stick to your eyes, your lungs, and your skin, really your mucous membranes. So you want to wear long sleeves. You want to wear pants. Again, cover up those eyes. If you're a woman, don't wear any makeup because that actually makes the tear gas stick more. And if you're a contact lens wearer, take that out as well. And some people have even recommended taking an umbrella. But the bottom line is the peaceful protests where there's less chaos, less tear gas, less people running around are just much safer than the ones that turn violent.
Go ahead.
Well, no, I was just thinking that those are really great tips, Dr. Kohli, because everyone who is feeling in their hearts that they need to take the streets are also having it in the back of their minds that they need to protect themselves. So I appreciate you sharing that with us.
Well said. Thank you, Dr. Kohli. You'll be back tomorrow, continuing to weigh in on our nation's biggest stories and how it impacts our health.